The CDC is sounding a warning as millions of Americans hit the road for 4th of July celebrations. It says the number of COVID infections in the U.S. spiked 10% this week. The health agency believes a combination of the more contagious Delta variant first detected in India and lagging vaccination rates could be to blame. And for more on this, let's bring in Dr. Bob Lahita. He's the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Lahita, thank you so much for taking the time to chat with us. Some local health officials are warning of a possible new wave of infections. From your expert opinion, how concerned are you?
I'm not as concerned, Tom, as I was last year, because I think in the well-vaccinated areas of the country, such as the West and the Northeast, we're not going to see a tremendous spike. What I'm worried about are those states where the vaccination rates are low, states like Wyoming or Missouri. In those states, we expect to see a bump up of infections due to the Delta variant. Remember, this virus is 60% more transmissible. And even if you're vaccinated, you still run the risk of being infected. Your clinical state will be a lot easier and you won't get as sick, but you still could get infected, so-called breakthrough infections, Tom.
So one interesting thing is Johnson Johnson. They've said that their single-shot vaccine is effective at protecting against the Delta variant. It also provides long-lasting protection against COVID infection in general. With vaccines proving to be so effective, why is there still so much hesitancy around the country?
That's a good question, Tom. I really have no idea. And it's perhaps the fact that people are uninformed and have not seen what we in the health professions have seen. This tremendous surge of death, et cetera, last year in 2020, that horrible year where we saw so much death and destruction of human life. But, you know, the good news is that the Moderna, the Pfizer, and now the Johnson Johnson vaccines are very robust against the Delta variant. So people should know that. A lot of patients have told me that, well, it's still experimental. It's really not. But they're saying, well, the FDA has not officially approved these vaccines, and that's a reason that they have not gotten the vaccine. So I think they should drop those concerns, worry about being infected with the Delta variant, and going ahead. J&J has shown that their vaccine is effective for out to 8 months, which is great news, against the Delta variant. So that's good stuff. Robust cellular and robust antibody response.
Yeah, certainly. To your point, with millions of people getting this vaccine, that's all the more proof that these vaccines are safe and effective, right? I want to take a look at this weekend. Obviously, it's no secret many of Americans, including myself, are traveling. Mask mandates are lifted in nearly every state with no concrete way to know who is vaccinated and who is not. What do you think is the best way to stay protected?
I think the best way to stay protected is to wear a mask and wash your hands. I don't think it's realistic to think that social distancing when you're watching a parade with 50,000 people or you're out watching a fireworks display with 100,000 people, as in some parts of the country, that's not realistic. I think if you, the individual, have symptoms such as a fever, such as muscle aches, you really should bow out and not take part in the festivities. But for everybody else, the only time I suggest you wear a mask is on a bus, a plane, a train, because you're around people in close proximity, just as you would be during a fireworks display, close proximity to those people who may well be infected but be asymptomatic.
Some good advice there. Is there any data about asymptomatic people spreading COVID that might warrant more mask using?
Yes, there's new data about younger people. I mean, these data, Tom, are from the United Kingdom, from Britain, who are saying that, 99% of those infected currently in England are with the Delta variant. And they're seeing kind of unusual symptoms. There's no loss of taste or smell, as everybody looks for, but there's a lot of fever, sore throat, cough, runny nose, and a few aches and pains. If you have that, you probably should get tested for COVID, particularly if it's a really bad cold that you're not used to getting. This is really important, and you certainly should not go out into a crowd if you have those symptoms. Remember always to wear a mask, wash your hands. Very, very important.
Well, let's hope that everyone has a very safe 4th of July. Dr. Bob Lahita, we always appreciate your time. Thank you.
Thanks, Tom.